Hey, thanks for being here. If this resonates with you, I'd appreciate it if you subscribed. Helps me keep making these.
There's a particular look people get when they've been on blood pressure medication for a while. Not sick, exactly, just managed. The numbers behave. The doctor is satisfied. But something doesn't feel resolved.
I see it in clinics sometimes. Someone's been on two, maybe three medications for years. Blood pressure reads fine, 128 over 82. Textbook control. But they'll say something like, I still don't feel quite right. Or, is this just how it is now? And there's this unspoken question underneath. Am I actually getting better, or am I just holding the line? That question matters more than most people realize, because hypertension isn't what we were taught to think it is. It's not a simple plumbing problem. It's not too much fluid pushing through pipes that need a release valve. That model made sense in the 1970s when we didn't know better, but we know better now. And once you understand what's actually happening inside your vessels, the whole conversation changes. Let me tell you what I mean. When I'm operating, cardiac cases mostly, I'm working with arteries directly, holding them, cutting them, sewing grafts onto them, and you learn things that don't show up in textbooks. A healthy artery, when you cut it, has give. It's elastic. It springs back slightly. There's life in the tissue. But an artery from someone with long-term hypertension, it's different, stiffer. Sometimes calcified enough that getting a needle through takes real effort. The walls don't flex the way they should. They've changed. And here's the thing. That stiffness, that structural change, is hypertension, not the symptom of it, the thing itself. Your arteries are lined with a thin layer of cells called the endothelium, one cell thick, fragile as tissue paper, but incredibly active. This layer controls blood flow, prevents clotting, manages inflammation, keeps everything running smoothly. When it's healthy, your blood pressure stays normal. When it's damaged, pressure rises. The endothelium has a protective coating on its surface, microscopic, called the glycocalyx. Think of it like a non-stick layer on the inside of your vessels. It keeps blood flowing smoothly. It blocks inflammatory molecules from reaching the vessel wall. It signals your vessels to stay relaxed and open. But this coating is delicate. High blood sugar strips it away. Chronic inflammation erodes it. Smoking burns through it. Oxidative stress dissolves it. Once it's gone, the vessel wall is exposed. Inflammatory molecules stick to the endothelium. White blood cells attach. LDL cholesterol penetrates. The vessel becomes inflamed. Plaque starts forming. The endothelium stops producing nitric oxide, the gas that keeps vessels relaxed. Your vessels constrict. They stiffen. Pressure rises. This is where hypertension actually starts, not from too much salt, not from too much water, from damage to the vessel wall itself. And here's what nobody tells you clearly enough. Blood pressure medication doesn't repair that damage. I'm not saying medication is useless. It's not. It manages the pressure. It protects you from stroke and heart attack while your vessels are damaged. That matters. That saves lives. But it doesn't fix the underlying problem. ACE inhibitors relax your vessels by blocking a hormone. Calcium channel blockers prevent vessels from constricting. Diuretics reduce fluid volume. Beta blockers slow your heart rate. All of these bring the numbers down, and that's important for immediate protection. But none of them restore the glycocalyx. None of them reverse the stiffness. None of them heal the endothelium. So your blood pressure might be controlled, but your vessels are still damaged, still vulnerable, still progressing. I had a patient a few years back, 67, been on 3 medications for 8 years, blood pressure well controlled, 128 over 82. His cardiologist was happy. He felt fine. Then he had a heart attack. Not massive, but enough to need bypass surgery. When I opened his chest, I could see the problem. His coronary arteries were calcified, rigid. When I tried to sew a bypass graft onto one of them, the needle barely went through. The wall was almost concrete hard. He'd been on medication for 8 years. The medication had controlled his pressure, but it hadn't protected his vessels. He shouldn't have needed that surgery. But nobody had told him that controlling the number and reversing the disease were two different things. So let me be clear about this. If you're on blood pressure medication, stay on it. Don't stop. Don't reduce it without your doctor's guidance. The medication is keeping you safe right now. But understand that while medication manages pressure, it doesn't reverse vascular damage. Reversal requires something different. It requires addressing the mechanisms that created the damage in the first place. And there are 3 that matter most. First, protecting and restoring the endothelial lining. The glycocalyx I mentioned earlier can regenerate. Not quickly, not easily, but it can be restored if you remove what's damaging it and give your body what it needs to rebuild. High blood sugar is one of the biggest destroyers of the glycocalyx. Every time your glucose spikes, it's like sandpaper scraping the inside of your vessels. So blood sugar control isn't just about diabetes prevention, it's about vascular protection. That means reducing refined carbohydrates, not eliminating all carbs, just the ones that spike your glucose rapidly. White bread, white rice, sugar, processed foods. Replace them with whole foods, vegetables, proteins, healthy fats, foods that don't cause glucose to surge. Your glycocalyx also needs specific building blocks to regenerate. Sulfated polysaccharides. Sounds technical, but they're found in seaweed, certain mushrooms, and supplements like chondroitin sulfate. Antioxidants help too. Vitamin C, vitamin E, polyphenols from berries and dark leafy greens. They protect the glycocalyx from oxidative damage while it's rebuilding. This isn't fast. It takes months, but I've seen it work. Second mechanism, reducing arterial stiffness. When your vessels stiffen, your heart has to work harder. Systolic pressure rises. The difference between your top and bottom number widens. That's called pulse pressure, and when it gets too wide, it tells me your arteries have lost elasticity. Stiffness often comes from calcification, calcium deposits in the vessel wall. Now, calcium is essential, you need it, but it belongs in your bones, not your arteries. The nutrient that directs calcium to bones instead of vessels is vitamin K2, not K1, which is in leafy greens, K2, which is in fermented foods, certain cheeses, egg yolks, and organ meats. Most people don't get enough K2. And without it, calcium ends up in the wrong places. Vitamin D helps too. It works with K2 to regulate calcium. And magnesium. Magnesium actually prevents calcium from crystallizing in vessel walls. These aren't miracle cures, but combined, they can slow and sometimes reverse arterial calcification. I've had patients whose pulse pressure narrowed after a year of consistent supplementation. Their systolic came down, their vessels became more compliant. It's measurable. It's real. Third mechanism, restoring nitric oxide production. Nitric oxide is a gas your endothelium produces. It keeps vessels relaxed and dilated. It prevents clotting. It's one of the most important molecules for vascular health. But damaged endothelium doesn't produce enough of it. And here's the thing. You can't just take nitric oxide. It's a gas. It only lasts a few seconds in your body. You have to stimulate your endothelium to produce it naturally. Exercise does this. Specifically, exercise that creates shear stress, the friction of blood flowing against the vessel wall. Walking helps. Cycling helps. Swimming helps. Anything that increases blood flow. Resistance training helps too, but in a different way. It improves insulin sensitivity, which protects the endothelium from glucose damage. Even something as simple as isometric hand grip training, squeezing a hand gripper for 2 minutes at a time, has been shown to increase nitric oxide production and lower blood pressure. Nasal breathing matters too. Your nasal passages produce nitric oxide. When you breathe through your nose, especially during exercise, you're delivering nitric oxide directly to your lungs and bloodstream. Mouth breathing bypasses that entirely. Small thing, but it adds up. Now, let me talk about insulin for a minute, because there's a fourth mechanism that doesn't get enough attention. Chronically elevated insulin locks your kidneys into retaining sodium and water. It doesn't matter how little salt you eat. If your insulin is high, your kidneys won't excrete sodium properly. This is why some people cut salt religiously and their blood pressure barely budges. The problem isn't the salt, it's the insulin. Insulin resistance develops slowly. High carbohydrate diets, especially refined carbs, keep insulin elevated constantly. Your cells stop responding to it. Your pancreas produces more. Insulin stays high. Your kidneys respond by holding on to sodium. Blood volume increases, pressure rises. Fixing this requires two things. First, time-restricted eating. Not necessarily full intermittent fasting, but giving your body 12 to 16 hours without food each day allows insulin to drop. Your cells regain sensitivity. Most people can do this by finishing dinner by 7 p.m. and not eating again until 7 or 8 a.m. the next day. 16 hours fasting, 8 hours eating. It's not starvation, it's just structure. Second, resistance training. Building muscle improves insulin sensitivity dramatically. Your muscles become better at absorbing glucose without needing as much insulin. You don't need heavy weights. Body weight exercises work, resistance bands work. 2 or 3 sessions a week makes a difference. I've seen people's fasting insulin drop by 40% after 3 months of time-restricted eating and basic resistance training. And when their insulin normalized, their blood pressure came down without changing medications. Their kidneys unlocked. Sodium excretion normalized, fluid volume balanced. That's reversal, not management. Reversal. Now, I know this sounds like a lot. 4 different mechanisms, diet changes, exercise, supplements, time-restricted eating. And you might be thinking, how do I actually put this together? Here's how I'd approach it if I were you. Pick one thing. Just one. Start with blood sugar control. Cut out refined carbohydrates for 2 weeks. See how you feel. See if your numbers change. Or start with time-restricted eating. Finish dinner earlier, don't eat again until morning, give your insulin time to drop. Or start with movement. Walk 20 minutes a day, do some basic resistance training twice a week. Just start somewhere. Because the thing about vascular damage is that it's progressive, but it's also reversible if you address the mechanisms. Your glycocalyx can regenerate. Your vessels can become more compliant. Your endothelium can start producing nitric oxide again. Your insulin can normalize. It takes time, months, not weeks, but it happens. And as it happens, your blood pressure will start to improve. Not because you're forcing it down with medication, but because you're repairing the damage that was driving it up. At that point, you can work with your doctor to reduce medication gradually. Monitor your numbers. Track the trends. As your vessels heal, you may need less pharmaceutical intervention. Some people get off medication entirely. Some don't. It depends on how much damage there is, how long it's been there, and how consistently you address the mechanisms. But either way, you're healing, not just managing. That's the difference. Managing is pills for life. Reversing is structural repair. And you have more control over that repair than you've been told. Look, I'm not here to sell you anything. I'm just a surgeon who's seen what happens when people understand the actual mechanisms, when they stop thinking of hypertension as a life sentence and start thinking of it as a reversible condition. Because it is. Most of the time. Not always, not in every case, but more often than standard care would have you believe. If you found this helpful, I'd appreciate if you subscribed. I'm trying to share what I've learned in a way that's actually useful. Thanks for watching.